So after the surgical procedure, I expect there's going to be a little bit of pain, a little bit of swelling and bruising, usually minimal, not very much. But we give you some pain medication to make you comfortable during your hospital stay. And also when you're going home, we make sure that you have the adequate pain medication that you need so that you're not uncomfortable. Swelling is one of the things that happen after the surgery. It's part of the healing process. I usually recommend some supportive underwear or scrotal supports, in addition to using some ice packs on and off for the first 48 hours. And then after that, I think that just warm compresses and wearing supportive underwear works the best for most of my patients. The incision site usually has stitches that dissolve on their own. And on top of that, usually I place some medical glue that also kind of flakes off on its own. So very little care that you have to do on your part. Just keep it clean and dry. One of the important things to do after the surgery is that you have to pull on the pump in the scrotum to prevent it from getting stuck up and becoming difficult to access after that. I usually recommend that to my patients to be done about 5 to 6 times every day, and just a gentle pull down is all you need to do. Constipation is a very common complication from using pain medication. And so we recommend using some stool softeners along with using the pain medication so that you don't get constipated and have to go strain, and that can hurt you. After the surgery and on discharge, we'll give you some specific instructions regarding the activities that you can do and cannot do. We usually try to avoid any strenuous activity or lifting heavy weights after the procedure for about a week. If you are taking pain medication, we don't want you to drive. However, if you're not needing any narcotic pain medication and you feel comfortable enough, I think you can drive. Regarding returning to work, everybody's job is different and everybody's healing process is different. And I think within a week, most of my patients are able to go back to work without any problems. So the recovery period for this surgery is usually about a week. And I do expect my patients to start pumping up the device in about 2 to 4 weeks. And I expect that they're using the device by about 4 to 6 weeks after implantation. Please call me with any concerns or questions, and I'm available to answer any questions that you might have and address any issues for you. We want to hear about everything that happens, and we want to help you through it. After the surgery, I usually will make a follow-up appointment within a week to make sure that everything is going okay for you and you're healing okay. And then in about 4 weeks after the surgical procedure, I want to visit with you again and start pumping the device and teaching you how to use it. The device can be used safely in most patients by about 4 to 6 weeks after the implant surgery. Please feel free to contact my office anytime after the surgery with any concerns or questions. We are available to take your call 24/7.